So, if you're someone who keeps an eye on your kidney health, you know that feeling of waiting for one specific number, creatinine. And the thinking is always lower is better, right? Well, not always. In fact, sometimes a drop in that number can be a warning sign. Let's dive into why that is.
Okay, so you get your blood test results back, you scan the page, and there it is. Your creatinine is down. You feel that wave of relief. But is it really time to celebrate? Before you do, let's take a closer look at what that number might really be telling you. Because it's not always what you think. All right, first things first, let's get on the same page. What even is this number? Think of it as a kind of scorecard for your kidneys. But like any game, you've got to know the rules to understand the score.
So, creatinine is basically just a waste product, and it's totally natural. Your body makes it every single time your muscles do anything. I mean, whether you're crushing a marathon or, just lifting your coffee cup, it's just a sign that your body's up and moving. The whole process is actually pretty simple. Your muscles produce it, and then your kidneys, which are like the body's master filtration system, their job is to grab it from your blood and send it out with your urine. Fun fact, it's actually one of the things that gives urine its yellowish color. Now, you might look at these numbers and see, hey, the normal range is different for men and women. Why is that? Well, it's not just a random thing. It's all about muscle mass. On average, men just have more muscle, which means they naturally produce more creatinine. Simple as that.
Okay, so this is what most of us know, right? The conventional wisdom. If that creatinine number starts to climb, it's usually seen as a red flag. It suggests the kidneys are having a tough time filtering everything. Your doctor uses this number to figure out something called your GFR, or glomerular filtration rate, which is basically your overall kidney function score. A higher creatinine usually means a lower GFR, and that's why we all watch it like a hawk.
But, and this is a big but, this is where the story takes a turn. That number, all by itself, can be so misleading. A single snapshot in time, it rarely tells you the whole story of what's really going on inside your body. And this is really the heart of it. That drop in your numbers might feel like a huge win, but there are times when it means absolutely nothing about your kidneys getting better. And get this, sometimes a rise in creatinine can actually be a good thing. I know, it sounds crazy. Let's break down how that's even possible. So, we're going to walk through 3 really common scenarios where that creatinine number is basically lying to you. This is where we have to ditch that simple lower is better idea and look a little deeper.
Okay, scenario number 1. This is all about something pretty much all of us do before a blood test. Drink water. I mean, we're always told to hydrate, right? But it can have a really surprising effect on your test results.
This analogy explains it perfectly. Think of the creatinine in your blood as a spoonful of salt. If you put that salt in a half-full glass of water, the concentration is going to be high, right? But take that same spoonful of salt and put it in a full glass of water, now it's way more diluted. See? The amount of salt didn't change at all, just the volume of water around it. And it's the exact same thing with creatinine. If you chug a bunch of water before your test, you can dilute your blood and artificially lower that number. Your kidneys haven't changed one bit. All right, on to scenario number 2. And this one is all about where creatinine comes from in the first place, our muscles. So what do you think happens to the numbers if the factory that's producing the waste gets smaller? Okay, let's picture this. A patient's creatinine has been sitting at 2.0. Then they get a new test back, and boom, it's down to 1.7. On paper, you'd think, wow, that's a huge improvement in kidney function. But the real question is, why did it drop? And here's the kicker. What if that drop happened right after a major illness where the person lost a lot of muscle, or in a more extreme case, after a limb amputation? Are their kidneys actually healthier? Of course not. The factory producing the waste just got a lot smaller. So that drop from 2.0 down to 1.7, it has nothing to do with the kidneys filtering better. It's happening simply because there's way less muscle mass creating creatinine to begin with. The body's just making less waste, which gives this completely false impression that the kidneys have magically improved. Okay, let's get to our third and probably most counterintuitive scenario of all. This is the one where you might actually want to see your creatinine go up a little bit. I know, it sounds wild, but it can be a sign that a treatment is doing exactly what it's supposed to. We have some absolutely game-changing medications out there that can protect your kidneys for the long haul, especially for people with high blood pressure or diabetes. You might have heard of them, things like ACE inhibitors or SGLT2 inhibitors, but here's the catch. When you first start taking these drugs, you might see your creatinine go up a little bit, temporarily, and that can actually be a really good sign. And this is just so important to understand. That little bump up does not mean the medication is hurting your kidneys. It's often a sign that the drug is working. It's changing the pressure inside your kidneys to protect them from damage years down the road. If you panic and stop the medication, you could be throwing away years of potential kidney health. And this isn't just a theoretical problem. This misunderstanding has huge real-world consequences. I mean, just look at this chart. In some places, because of this fear of that creatinine bump, these life-saving drugs are only used maybe 10 to 20% of the time. But in places where doctors really understand this effect, that number jumps to 70 or 80%. That is a massive gap in care, all because of how we interpret one little number. So, where does this leave us? What does it all mean? It means we absolutely have to zoom out. We have to look beyond that one single number on a piece of paper. Your health is a movie, not a single snapshot. Your kidney doctor, your nephrologist, isn't just staring at that one creatinine value. They're looking at the trend. What's it been doing over months, over years? They're checking your blood pressure, the protein levels in your urine, how your heart's doing, everything else that's going on with your health. They're putting together a giant puzzle, and creatinine is just one piece. And really, that is the number one thing to take away from all this. Your job is not to micromanage that number from one test to the next. Let your doctor worry about the trend. You know, that little jump from a 1.5 to a 1.6 might feel terrifying in the moment, but in the grand scheme of things, it could be totally meaningless. So the next time you get those lab results back, just remember, there is a whole story behind that one number. Instead of obsessing over that single data point, talk to your doctor about the bigger picture, about the trend. Ask them questions, understand the why behind the numbers. Be a partner in your own care, because at the end of the day, when it comes to your health, it's the whole story that matters, not just one number on one day.